Well, all month long we are celebrating you, and we're wishing you a happy you year, and that might mean making a big change to your look that maybe it feels long overdue.
Now, over the next few months, we're going to be bringing you stories from Bashioum Cosmetic Surgery Center about moms who've decided that 2014 is a year to change how they look and feel. Twin Cities Live producer Kelly Hansen introduces us to a Hudson mom of 3 who decided that a tummy tuck would give her the confidence boost that she needed.
Ready? Christina Poser has a few imperfections she's ready to forget about.
I had always thought that a tummy tuck was more for somebody with an excessive amount of skin or fat, and it's really not. Toby, the train.
This stay-at-home mom of a 2, 9, and 10-year-old is preparing to head into the operating room for a procedure she says is long overdue.
My belly button bothers me, my scar bothers me. That's what I want fixed.
C-section and surgical scars and a hernia. They're imperfections she was told couldn't be fixed all at one time. The plastic surgeon, Dr. Ralph Bashioum, says a tummy tuck will take care of what she doesn't like.
But this is very straightforward and you should do well.
Christina is hopeful her results are like this. Before and after photos that show how removing extra skin and fat while repositioning underlying muscles can change the entire look of the stomach.
No tubes or anything. You just have to go home and relax, take a shower tomorrow, and you'll be done before you know it.
It's a procedure Christina says will give her more than just a boost of confidence.
What bulges out a little bit will be tucked in, and not having the outie belly button and a brand new one, that's what I'm most excited about.
Dr. Ralph Bashioum and Christina are here now to talk a little bit more. Thanks so much for joining us today, guys.
See you.
You're welcome.
Well, Christina, this happened about 10 weeks ago. Why don't you sort of tell, you look great. Tell us.
I feel great.
Yeah, how are you
Awesome.
feeling?
Best thing I've ever done.
Really?
Yes,
Great.
I
So
feel
this
great.
was something that was obviously, it was bugging you every day.
Yeah, well, I had 3 hernias and they would come out, and that was my problem.
Yeah.
But my insurance wouldn't pay for hernia because it was a pre-existing condition. So I thought I would look into plastic surgery and get a whole new look and make it nice while I'm at it, right?
And it sounds like you've got around 6 to 9 months, doctor, before she's really sort of reaping the rewards of this whole process.
The final healing process in about 6 to 9 months. Yet she can appreciate an improvement right now. Absolutely. Yet the healing process, the scarring has to heal over that period of time, and it's a dramatic change. She had quite the hernia around her belly button, which was a huge improvement for her.
Okay, so you're looking at the photos of Christina and you're not seeing Christina's face, the reaction to the photos. I mean, you see it obviously every day in
Yes.
yourself, but when you see those photos, the comparison, Christina, is it amazing?
It's amazing. I have a brand new belly button.
So, doctor, without probably getting into too much detail, I mean, you've rebuilt her belly button. This is something you can do, which I think is just absolutely amazing.
Yeah, it's a standard kind of procedure whenever we do the tummy tuck, is to, 1, tighten the muscles that have been stretched with pregnancy, remove as much of the skin as possible, contour with a little bit of liposuction, and then at the same time, if we see any hernia or any spot that needs to be repaired, it's a very simple thing to repair at that time. Much easier for than the general surgeons because they don't get quite the same exposures as we do.
So Christina obviously was a good candidate, but who else? What kind of things do you want to think about if you're saying, I might want to call Dr. Bashioum?
Well, people who have had massive weight loss will have extra skin that's been stretched, men or women. And then women have had children frequently will have changes in their body that diet and exercise will not fix.
Yeah.
The stretched muscles,
Boy, that is
any
a
minor
bummer,
hernias.
Dr. Bashioum.
I know. Well, it's a reality of that, but it's worth the children. You know,
Yeah.
that's the trade, and it's worth the children. And once a woman's been able to have her child, taken care of her child, has lost the weight that they want to lose within a reason, then a tummy tuck can be a choice to improve the things that bother them, and particularly a bad scar after the C-section, and these hernias were a real issue for her.
What kind of recovery time are we talking about, let's say, for a tummy tuck like Christina experienced?
Well, the recovery time, depending on the work you do. If you do manual labor, 3 weeks off work. For many of the clerical responsibilities or light labor, hairdresser, nail, salon, that about a week they can be off, and then ease back to work after that, maybe half days.
How did you feel about that, Christina? Was it better or worse, or did you feel like you were really prepared with right on with the recovery?
I had my sister staying with me to help out with the kids, so I wasn't lifting anything, I wasn't active, but the recovery it's tough, but it's totally worth it, and I would do it all over again.
Well, doctor, you're sort of talking a little bit about diet and exercise being a component of this, but let's say, for example, what Christina was dealing with, I mean, she might be able to diet and exercise until the cows come home, but it really wouldn't have
And I
done
couldn't do any core training because of my hernias. It would burst out of my stomach.
So you felt really limited, yeah.
Right, oh yeah, for sure.
So is diet and exercise, I mean, if you're doing a million crunches and you've had babies and you know, or you've lost that weight, are you gonna be able to tighten up on your own?
No.
No.
No, you can make the improvements that are important to retain that muscle tone, but you lose the mechanical advantage of the muscles when they've been separated like that. And when there's hernias, they can bulge out and create pain and actually can be strangulated, but that's very unusual for these kind of hernias.
And I can imagine that in the time you've been doing this, you've probably seen recovery times get shorter and even technology be able to advance.
Yeah, we've gotten to the point now where we don't use drains. Years ago we used drains, so we've gotten away from using drains. We don't use any kind of tubes. The convalescence, and one of the philosophies in our offices, is to simplify that aftercare as much as possible.
Yeah.
And since I had my tonsils out when I was 4.5, it hurt so bad, I want my patients to have less pain.
Oh, that's a memory.
Doctor, if somebody's seeing this segment right now and they're interested, what is the process like? How long from beginning to end are we talking?
They can come in for a consultation. Typically it's 2 to 3 weeks because they have to make sure they're healthy. There's some things we ask them to do for 2 weeks before surgery. They can have surgery, and then the convalescence is, the initial convalescence about a week or so. The final result they'll see in about 6 to 9 months.
We'll see, and winter lasts so long here, Christine, you won't even be seeing the tummy
No
out
problem.
in public till, you know.
Well,
Yeah.
actually, we're going on vacation
Yay!
within the month.
Oh, nice.
Plan a vacation,
Yeah,
that's
I'm
great.
ready.
She wasn't an emergency surgery, but we see many of those. People come in, they try on the bathing suit, and they say, oh, my tummy doesn't look right. Oh, the breast size isn't quite the right size. Oh, I got to get an emergency tummy before the cruise, or emergency surgery before the cruise.
So emergency might be used loosely.
Oh, well,
there.
it's a loose
Thanks
Thanks,
so
term.
guys.
much. Thanks, nice
Appreciate
to
it.
meet
Oh,
you.
you're welcome.
All right, and make sure and call Bashioum Cosmetic Surgery Center to schedule your consultation today. We posted more on our website, TwinCitiesLive.com.
All right, next month you're going to meet a Rogers mom who underwent breast reconstruction, and we want to thank Bashioum Cosmetic Surgery Center for sponsoring Twin Cities Live. And Christina for being so brave. She's very brave. All right.
Thanks for sharing your story.
Still to come.